Now we shall have a discussion about nephritis, or what some people would call a nephritic syndrome. The patients can either present acutely as an acute kidney injury or as a chronic kidney disease. After we have excluded pre-renal and post-renal causes, we will then have to think of a renal cause of either AKI or the CKD, and we will suspect that the patient has got a nephritis if there's presence of hypertension, a cellular urine, either a hematuria alone or a hematuria with a pyuria. The patient may or may not have renal impairment depending on how early he has presented. Acute nephritis or chronic nephritis may be due to a glomerulonephritis or a vasculitis. Causes of glomerulonephritis would include an IgA nephropathy, a lupus nephritis, post-infectious glomerulonephritis, and a membranoproliferative glomerulonephritis. IgA disease is more commonly seen in a male, lupus nephritis in a female, and a membranoproliferative GN usually in a younger patient or in a patient with hepatitis C infection. Common vasculitic conditions that can affect the kidney include a microscopic polyangiitis, granulomatous polyangiitis, previously known as vaginous, granulomatous polyangiitis with eosinophilia, previously known as a Church-Strauss disease, and finally, polyarteritis nodosa. There is a subset of a nephritic picture, which is the rapidly progressive glomerulonephritis. If you do a kidney biopsy for such patients, we will see a chrysantheric glomerulonephritis. There are four main subsets, the first being an immune complex mediated condition, which would include IgA nephropathy or lupus nephritis. A chrysantheric GN can also be due to a pauci-immune condition, and this would be related to conditions such as your microscopic polyangiitis or granulomatous polyangiitis. It may be due to a direct attack on the basement membrane due to a anti-glomerular basement membrane antibodies, which will give us the Goodpasture's disease if it only affects the kidneys, or the Goodpasture syndrome if it affects both the kidneys and lungs. And finally, RPGN can also be idiopathic. So what we have covered here is the diagnostic approach to nephritis. Most of the time, these conditions will have to be confirmed with a renal biopsy, but it is important when we are trying to work out a renal cause of the AKI or CKD to look out for the presence of a nephritis with hypertension and a cellular urine. Thank you.